I think the screening colonoscopy reduces the risk of cancer if polyp or tumor discovered early, especially with the patient who's over 50 or patient who have family history of cancer or colon polyp.
What we're looking for are pre-lesions to cancer or polyps. Polyps are abnormal growth of tissue, and the larger the polyp is, the higher percentage that it may contain cancer cells. So we're looking for polyps to remove those polyps. By removing the polyps, we avert the patient developing colon cancer.
They're different from person to person, but average it's when you are 50 and above, usually do baseline screening colonoscopy. And if it's normal, you go for 10 years. If you have family history of cancer or family history of colon polyp, you do it earlier, about 10 years early. Now, if you have other conditions like ulcerative colitis or some high-risk condition, you do it more frequently than other people do. But in general, over 50 we recommend it for the screening colon.
The process requires that the patient goes to their primary care physician. Primary care physician generally will refer them to an endoscopist where they will order preparation for them to have the colonoscopy done. The preparation usually requires a 24-hour time frame the day before the procedure where they are on a liquid diet, drinking some fluids that causes them to evacuate their bowel.
Well, you get a prescription from the pharmacy that you have to drink. Like the one that I have is called Go Lightly, and it's got a pineapple flavor, which wasn't too horrible, and you just have to drink it for about 4 or 5 hours.
I think there's a lot of preparation in the market at this time. So preparation can be easy. The risk is very minimal. And people are afraid from perforation or bleeding. And those are very minimal if done by expert. And there's no reason really to be worried about the procedure itself, because it can be done with ease, and the result usually you have it on the spot and give you peace of mind.
It's just the prep that sort of is the hardest part, and that's not even that hard. The surgery itself, you're asleep and you wake up and you're like, really, it's all done? So that's what I remember.
The patients are asleep, they are under IV sedation, they're not aware of the procedure at all. They generally wake up and are really surprised that the procedure has been completed. So it's very, very comfortable.
I think that preventive medicine is really a good thing to do, and if you have any history of it, I think everyone should have it done at certain ages of their life just to make sure, because cancers and different things that you might end up having or polyps that could turn into it, they can nip it in the bud before it turns into something really serious. So I think it's a good thing to have done.